Peter, fantastic results for the year. Do you want to talk us through the figures?
Well, you've got to start with sales, Tamsin, and sales are significantly up at 5.5 million. And with a business like ours, which is high margin, we have a modest cost base based on the 13 staff that we have and the reagents that they consume and other facilities costs. That's had a direct effect on the profitability. And so you can see that in the final results. We're thrilled with that, and there's been some intrinsic growth from our vitamin D antibody, which we're delighted about. And this has come from some big customers who have rolled out their tests for vitamin D deficiency around the world, and we've benefited from their success in dollar terms. In addition to that, as everybody knows, there's been a change in the value of the pound, and that has meant that the royalties that we generate from our customers' global sales, which are dominated by hard currencies such as dollars and euros, when converted to pound sterling back in London, has resulted in a significant uplift in the sterling revenues that we've seen this financial year. The tax that we pay is offset to some extent by tax relief from science-based research, but nevertheless, the profitability has resulted in and yet a further increase in our cash position, despite the fact that we have paid increased dividends over the last year. The profit before tax was 4.2 million and after tax 3.5.
And your cash position?
Our cash position grew during the year such at the end of the year it was above 5 million, and that's a point at which we at the board discussed our cash and the need for cash to facilitate the agility that we seek in our operations. We identified cash that was surplus to that, and we have now decided to distribute that in the form of a special dividend of 20p per share to our shareholders this November.
And ongoing, do you see that dividend being sustained at that sort of level?
We have consistently stressed the continuity of our dividend policy, and this is a policy that we will retain into the future. Each year we will look at our cash position and manage and monitor it as we so choose, based on the principles of continuity and the retention of sufficient cash to operate a flexible, agile business.
So for vitamin D, are the revenues sustainable? Do you see the demand for vitamin D continuing?
Well, vitamin D is perceived as being an important part of human health, and vitamin D testing is becoming a norm around the world, initially started by initiatives in the United States, but now in Europe and also in Asia too. It follows the belief amongst the vast majority of clinicians that vitamin D is important, not just in rickets, which has always been the understanding, but is also important in other areas of human healthcare too. And so testing of vitamin D, certainly in vulnerable individuals, such as children, pregnant women, and the aged, is now commonplace in many advanced societies.
And do you think we can see sustained growth in vitamin D?
There is certainly markets in the world where one can see evidence of plateauing in the United States, whereas in other areas where in Europe there's an evidence of increasing awareness and a tendency to test amongst clinicians, and also in Asia where there's a growing awareness and desire to test for vitamin D deficiency in patients.
Out of Europe and Asia, which do you see as the greatest growth opportunity?
I think we can see potential in both. As a cautious forecaster, I will wait patiently and see how those markets develop.
Foreign exchange has had a big impact on revenues for you this year. Does that raise the bar very high for ongoing years? You know, Forex is always difficult to predict.
I see my job as growing our business organically, and that will result in organic growth in dollar and euros. As to what happens to the pound sterling and its relationship with those currencies, I see that as being out of my control. The consequence will affect our sterling results, and my plan is not to become overly concerned with that and just concentrate on growing the intrinsic value of the business. And observers will then, I will leave it to them to factor in their view on exchange rates and how it may or may not impact on our future revenues.
Do you have any figure? You know, a 5p drop in sterling leads to a X amount increase in revenues.
A 1% drop in the value of the pound against that basket of international currencies will result in an increase of 1% in our sterling revenues. It's as simple as that. Regarding our profitability, we're a very high margin business anyway, so there will be a consequent effect on the profitability of the business. As a consequence of the increased revenues. Our costs are modest anyway, but the majority of our costs are in the 13 staff that we have, and those are clearly sterling-based costs.
So NT-proBNP licence comes to an end at the end of 2017. Does that affect revenues in 16-17?
We do have a revenue stream which is linked to NT-proBNP, which will continue throughout 2016, 2017, but will terminate in 2017, 2018, such that in the financial year 2017, 2018, we will lose £700,000 to £800,000 worth of revenue, which is a straight, clear loss of revenue.
And you have troponin that's coming on stream in July 17?
We've been working with Siemens Healthcare Diagnostics for around 10 years now on a new generation high sensitivity troponin test, which will facilitate earlier diagnosis of heart attacks when used on the Siemens testing platform. Now, we've been working with Siemens for around 10 years, and our expectation is that they will be able to launch this new troponin test outside the United States of America at some time during 2017, such that, and it's a very important test for us insofar as the diagnostics of heart attacks is a big diagnostic market, it's a big diagnostic for Siemens, and so we expect significant revenues from that in the financial year 2017-2018. And our expectation is that the benefit from that launch in 2017-2018 will more than balance the revenue that we will lose from NT-proBNP.
But Siemens are in charge of driving that forward. How motivated are they to get it moving?
It's an important product, as I understand it, for Siemens. Troponin is right now an important product for them. The new generation of high sensitivity tests, which our antibodies help facilitate, those tests have already arrived, and their competitors, Roche and Abbott, already have similar tests on the market in the EU, not in the United States yet. No one has such tests available in the US just yet. But certainly, being behind their competitors in the EU will be a big issue for them, and they will be motivated to catch up.
So they're waiting for EU regulation to be passed?
They're waiting to generate the data that will be required to submit to the European authorities for CE marking, which can then facilitate a product launch in Europe, which they anticipate to be during 2017.
And should they get go-ahead in July 17, how quickly will it take them to ramp up to be able to start putting the test in action?
Well, it's a great product. The new sensitivity troponin tests help diagnose heart attacks positively or negatively within 2 or 3 hours. And that's of immense benefit for patients, be they positively or negatively diagnosed, and for the hospital providers in terms of vacating beds and making better use of those beds in A&E facilities around the country. So there is a great benefit for the industry, being the providers of the diagnostic tests and the consumers, the hospitals, to implement this new technology and get it approved and get it in use, because it's in everybody's interest so to do. So we think that Siemens and their customers will be very anxious to implement these new tests for the benefit of everybody.
And practically, what needs to happen in order for them to do it in terms of timing? You know, the antibody needs to get to the hospital and the hospital needs to know how to use it. How long does all of this take?
Siemens are a very large professional diagnostic company. They will have geared up manufacturing of the antibodies, which they do themselves, and the reagent packs that are required to slot into the blood testing machine. That will already have taken place. Following approval to sell in the EU, the healthcare specialists that visit their customers around hospitals in Europe will have primed the expert blood testers within those hospitals on how to use the new test and to help the diagnosis of those patients. So with that in mind, we're anticipating a relatively quick rollout of their new products in countries where they gain approval.
And you imagine this could happen from July 17?
July is an important date because it's the middle of 2017, and 2017 is the best estimate that we have to work on.
And so if it did happen then, what would the implications for revenue in 17-18 be?
Well, we'll have to wait and see what the precise numbers are, but a reasonable assumption is that we will at least match the shortfall in revenue that we're losing from NT-proBNP.
So that would be 700,000 or 800,000.
Yeah, and that's a perfectly reasonable assumption based on what we know right now.
And what is the whole market size? What is the total revenue you could get from Siemens for troponin?
Well, that's an area of research which our friends at ThinkCap have been involved with, digging out the numbers, and ThinkCap estimate the global troponin market to be around $1.3 billion, and the Siemens market share has been estimated at 10 to 12%, and people with calculators can work out what the potential benefit of that might be to Siemens, and we will, through our arrangement with Siemens, share in the benefit of that.
So what, that would be about £2 million?
Our friends at ThinkCap have estimated a plateau peak value of, in the short to medium term, of £2 million. Of course, troponin testing has the potential to grow in its own right, as it could potentially be used not just for people with suspected heart attacks in A&E, but also as part of routine blood testing. But that is not in place right now, but it's a potential area of market increase for troponin.
So if you start off in the first year of sales of around 700,000 or 800,000, would you imagine it to increase incrementally up to 2 million each year?
I see our revenues getting to, of that magnitude, £800,000 in the first year, 2017, 2018. Beyond that, I would merely make the loose statement that I see a gradual rollout of Siemens products around the world in different territories. The United States will be a challenge for them, but they're being a professional company. They're up to that challenge, but nevertheless, the actual pace of that rollout could well be a matter of 2 or 3 years before we see that approach a point of completion.
And for America, you're imagining that the first date that they could possibly get in would be July 2018 onwards?
I think their launch plans in the US are intrinsically entwined with their discussions with the American Food and Drug Administration, and the outcome of that is very difficult for anybody to predict. But it will take longer to get approval in the US than it does in Europe and other countries in the world. Having said that, there is the same demand in American hospitals for these tests to be approved for use. So it would appear obvious that it is inevitable that these tests will eventually be approved when the authorities are satisfied that they are ready for sale.
It's interesting that Roche and Abbott have been approved in Europe. Presumably they've been trying to get approval in America for all the time that they've been in Europe.
They have indeed, and the FDA have been quite demanding about the new tests and what is known about them by the providers, and the fact that Roche and Abbott have spent a lot of time deliberating with the FDA and yet still do not have approval is a testament of the degree of difficulty in seeking approval.
Or that might make it faster for Siemens, so everyone arrives at the finish at the same time.
It may well do. Yeah. We'll have to wait and see.
So beyond troponin, what other antibodies are likely to come on stream next?
We have a number of antibodies that are coming on stream through our own R&D resource, and we have some other projects that have come through customer-sponsored R&D, and many of those are technically very exciting. I think it's fair to say that none of them are of the same dimension or the same magnitude or value as the things that we've talked about if compared to vitamin D, and BMPs and troponin.
And with the other antibodies that you have, are they remaining static or are any of those likely to grow significantly?
Our core business remains robust and tends to grow modestly by 5 to 10% in dollar terms each year. And that's a function of the revenue continuity that's afforded by the use of these antibodies on machines. It does take quite a while, as we've talked about with troponin, for customers to gain approval to market new diagnostic tests around the world. And because of that, the same customers are equally reluctant to revisit that entire process in order to change an antibody. So customers are motivated to do that in the event that there's a technological advantage. If there is no such technological advantage, an antibody, be it ours or somewhere else's, will remain in use on a blood test for many, many years.
So presumably that's a very nice barrier to entry.
In a business perspective, it would be viewed as a barrier to entry. In science terms, it's a means of technical continuity and product quality at one's customer. If you change the antibody, you will change the product. And in a situation where a product works, no one has any desire to change it.
And in terms of risks to the business, is consolidation of the business, so some of your main customers consolidating, is that a threat?
There's been consolidation in the industry over the last 5 or 10 years. For example, Siemens Healthcare Diagnostics did not exist 10 years ago until they purchased Biodiagnostics, Dade Behring Diagnostics and DPC of California. So consolidation has taken place. However, in the case of Siemens, what has happened is that a company is now controlling all of those heritage businesses, and yet the machines made by those old companies are still placed in hospitals all around the world, still as at today. So there is still a great deal of continuity in the form of the physical machines and the reagents, i.e. antibodies that they use, and so that is not changed by changed ownership of the machines.
And in terms of technology, is there anything that will threaten the antibody market?
Antibodies have been around for many, many years, and we see them continuing as a dominant force in diagnostics. So one can read about alternatives to antibodies per se. I would always be cautious about any technology replacing antibodies, certainly in my lifetime. Having said that, there are other technologies which are relevant to our business, such as rabbit monoclonals, which are a technology which I do respect, and as a good alternative to mice, in the same way as sheep monoclonals are a good alternative to mice. So rabbit monoclonals are a serious threat, and insofar as they're adopted, particularly by our customers, does pose a limited threat to possible projects that we might miss in the period 2020 to 2030. But I don't see it as being a threat to our existing business where our antibodies are used, where there's still no incentive to replace them, whatever the source of a novel antibody. If an antibody facilitates a good test on a machine, it will stay in use.
And would that encourage you to research other, like rabbit, or instead of sheep, or would you stick with sheep?
For our base technology, I see us sticking with sheep for many, many years to come. But that does not mean we do not also invest in new antibody-based technologies, and we devote a certain amount of our research resource to antibody technologies and antibody tools that we think will be useful in the period 2020 to 2030, and that forms part of our research effort.
And in terms of your overheads, your staff is probably one of your largest costs. What do you do to motivate your staff?
Staff need to be motivated to perform well. It's like any team, people need to enjoy being part of a team and to enjoy the work that they do. And so that's an important hallmark of any successful team. In our team of scientists and admin people in Farnham, I like to think that there's a positive and enjoyable atmosphere that people work in that is casual but effective and efficient and productive. So I like to think that's the case. And as far as rewards are concerned, clearly people have got costs in their lives, and staff need to be duly rewarded. Sadly, the reality of working in science in this country in particular, or probably elsewhere in the world, working in science is not as well paid as it is here in the City of London. Having said that, we make sure that the fruits of our success are shared amongst all stakeholders, and we do have regular staff bonuses which are enjoyed by members of the team. And I'm sure that does in part help in the issue of motivation.
Peter, it's been a pleasure, and congratulations on amazing results.
Thank you very much indeed, Tamsin, for your interview and your kind words.